Thank you for coming here. I am Dr. Uramgin, the director of Wine Plastic Surgery Clinic. I'm really nice to meet you. Well, actually, I'm very friendly with Turkey people. Yeah. Is it okay, Turkey?
Yes.
Yeah. Actually, my father was the first Korean professor in Ankara University 30 years ago. Yeah. At that time, Turkey was really accustomed to Korean, but nowadays, yeah, we are very close. So at that time, I learned that sentence, merhaba. 태식해라 대로. 좋길래. 좋팔래, right there. Well, actually, I'm a plastic surgeon. I've performed surgery lifting for almost 20 years. Yeah, what a long time. And I've collaborated with Alfa Medical for almost 8 years. So I could meet a lot of doctors from many different countries. Is there any doctors who've been to my clinic before? No? The first time, I see. So then why don't you call me to Turkey? Yeah. Next time, yeah, please call me to push him. Well, actually, I prepared a lot of, yes, well, I should prepare for this first. Actually, the lecture must be very long, so I'm worrying because I've also presented a lot of times in front of a lot of doctors from many different countries, but yes, it's too long, I know, but he already pushed me to inform us everything. That's why the presentation should be quite long. I beg your pardon first, and then I cannot speak English so fluently. It must be I have Korean accent. It must be torturing for you to endure my presentation. Well, actually, it's a good idea. I'd like to take a picture and read all you guys. Yes. It can be how this way? 1, 2, 3, kimchi. Okay, thank you. Yes. Well, so let's talk about the thread lifting. Yes. Do you eat kimchi?
Yes.
Yeah, really? Oh, thank you. Thank you. Yes. Actually, he invited me to the Greece, right? Greece? Yes. Fortunately, I got the business class. At that time, I used the Turkish airline. They serve the kimchi, not for Korean, for everybody. So, we have two topics today. The first one was PN, polynucleotide. It's a long chain of DNA, but previously we also used the PDRN, short chain of DNA. So as you mentioned, it acts like some growth factor. It regenerates our skin, but not only the growth factor, but also it has some scaffold-like effector. So actually, do you know Ozempic? Ozempic? Yeah, GLP-1 inhibitor. It's also very popular here. I got it many times. I lost my weight yes, I did. Almost 15 kilogram. So my pace dropped a lot. So to recover from that pace, I injected PN a lot of time. Finally recovered. So it must be the next generation. You can guess.
20.
Thank you very much. Yes. I have 20 years old son. Thank you. Yes, I'm almost 50.
Oh, really?
Yes, yes. But you know, the first Asian looks younger. At the PN, I became 10 years younger. Yes, exaggerating, I know, but yes, it makes it better. Usually, first Asian looks younger. Okay, the one more topic, the thread. Yes, the thread. But as we know, the thread lifting is quite complicated. We should learn how to apply, and we should also master the product one by one. So it's quite difficult and complicating. That's why my presentation is so boring and long. Let's start now. Okay, why thread lifting is so popular procedures in aesthetic fields? Yeah, it's also very popular, like toxin and filler in Korean aesthetic market. I heard that Turkey is one of the destination of aesthetic journey, right? Yes, I heard that.
Yes.
Hair transplantation. Good, yes.
Especially Istanbul.
Definitely. In Korea, this aesthetic competition is really serious here. To survive here, there are a lot of thread companies, there are a lot of thread aesthetic clinics. We should develop our techniques day by day, year by year. That's why our technique became much developed than before. The thread lifting is really popular here, really prevalent. Every clinic, they apply thread. Why is it so popular? For the patient, it has short recovery time. The applicable, it looks natural. But for physician, lifting is only the procedure for plastic surgeon, the conventional surgery, I mean. But nowadays, you can apply thread if you are a physician. Strictly speaking, even though you are not a doctor, you can apply thread. In many countries, even in aesthetic shops, they apply thread instead of doctors, But nowadays, to perform sophisticatedly, we should learn how to apply the thread. It's also very important. But fortunately, it has less complication than that of conventional lifting surgery. But it also has some disadvantage. It is under correction. The patient cannot be satisfied with the duration of thread lifting as well. So to satisfy our patient, we should know their expectation first. How long does it go? Or maybe, in my case, most of the patients believe that the effect will go on at least 2 or 3 years. Then how long does it go? Okay, it's a secret, but it's a secret talk among doctors. How do you believe that it goes? 8 months. 8 months.
I think 1 year.
1 year.
One and a half.
One and a
Max.
half. 1.5.
5 years.
5 years. 5 years. Good. Then, before we talk about this topic, we should know the material of thread. What's the material of thread nowadays you use? Which chemical?
Video.
Yes, PDO. Polydioxanone. Absorbable thread, right? So, do you know how long does it go? The PDO itself?
6
Yes, 6 months. It's 6 months. It will be hydrolyzed when it meets the water. It starts to collapse, start to creak, start to break down. When it meets the water, it's hydrolyzed. But it takes time. First, the chemical company manufactures the PDO thread, then it moves to the lifting thread company. They process it, heat, press. There can be some damage. And in warehouse, it takes time. And it also takes time to import the material from Korea to Turkey. And even in distributor in Turkey, it takes time in their warehouse. Even in your clinic, the thread will be stored in the shelf. Even though they close up the case, the waterproof case, but it's not stable. So actually, it must be very shocked. The fact is, the duration of PDO thread is only 1 or 2 months. I'd like to share my experience. As I mentioned, I applied the thread for about 10 years. At that time, I applied the thread I inserted the thread over the hairline. Sometimes the hair can be inserted into the skin with the thread. Finally, it can cause infection. To treat this patient, I tried to remove the thread. It's a foreign body. If I remove it, I can treat the patient earlier. because there's a localized abscess, I can find out where the thread is, I cut the abscess. Fortunately, I found it. It became already white, not the blue anymore. I tried to pick it up with forceps, but it happens in 6 weeks after the procedure. You know, infection is extremely rare. Only the hair can cause infection. So it's very stable, but it's a very rare case. I tried to pick up the thread, but I failed. Why? I found it. I grabbed it, but I failed to remove it because it collapsed in 6 weeks. If I get it, it collapses. If I get it, it collapses. I cannot pull it out. Do you understand that? Like a chalk, like a wheat chalk. Yes. Already in 6 weeks with the PDO, it happened here.
But the effect is more.
Definitely, because it can make some collagen. Yeah, I agree, definitely. But the physical aspect of thread lifting only goes 1 or 2 months. That's why what I want to emphasize. You know, Korean has a thicker, bigger skin, so it's not so easy to lift Korean skin. For Europeans, frankly speaking, easier than skin, better skin, yes. But my patients always complain of the duration of thread. It only goes 1 or 2 months. I understand that. The physical aspect of thread itself ends at the point of 1 or 2 months. That's the reality. So, it happens. 밖으로 나가셔야 된다고 말씀해 주세요. 밖으로 나가서 2층. 네. It starts to creak, collapse. That's the destiny of PDO. Then it's not thread anymore. It doesn't have any tensile. Actually, this trait is the physical aspect of thread. Tensile strength. It should endure the tension. Because it's lifting, the cork should anchor the tissue properly. And the cork should endure the tension, not to be damaged. This is the three aspects of the physical character of the thread. But we cannot expect chalk. For chalk, we cannot expect these three aspects at all. So how could we improve this? The first thing we should consider the second candidate of the material. The first candidate was PLLA. You've already heard of that material, right? Polyl-lactic acid. It's really good. It goes for at least 4 times longer than PDO. At least 18 months, I heard. But it's too hard. When you insert the PLLA thread on patient's face, it will stick out easily. The patient will complain of foreign body sensation. So it's not so proper, I guess. Then we move to the second candidate, PCL, polycaprolactone. By the way, the PCL is too soft. Of course, soft means it has high plasticity. We cannot make a complicated model of thread with PLLA because it's too hard. PCL, yes, we can, but it's too soft. It cannot anchor the tissue properly, and the melting point is really low. During processing, it will melt down. Finally, they combine them together. So the material is also called the PLACL, new material. Actually, this is the future of the lifting thread, PLACL. The Alfa Medical is one of the only company who deal with these materials for lifting thread in Korea. This thread goes for at least 18 months, about 3 or 4 times longer than PDO. You know, 1 month, the 1 month is a very critical point. Around 1 month, the thread will gather the collagen fiber around it. But with the PDO, they cannot make it a line structure because it's already collapsed, already cut. But PLLACL is really intact even at that time. So The melting point is much higher than PCR. Softness. PCR is very soft. Then PDO, then PLA-CR. PLA-CR is slightly harder than PDO, much softer than PLA. PLA-CR. So you should memorize this word, PLACL. I compared this two thread. PDO, soft, quite soft, reasonable. PLA, do you feel the difference? It's quite hard. This is a PCL. It's very soft, pliable. So even difficult to grip them. The last one is PLA-CL. Slightly harder than PDO, much softer than PLLA. Longevity 18 months, slightly harder, which has better anchoring power, resistant to damage. So this is a PLA-CL thread. We do not tie them, which means it's transparent or white. Nowadays, I do not use a PDO thread anymore because to satisfy my complicated Korean patient. Okay, so there are a lot of lineups of lifting thread. Previously, they used cutting cork, but nowadays, molding corks are very popular. You may know the difference, right? I don't have to explain this here.
Yes, I use both of them.
Definitely. Yes. I do not use a cutting cork anymore because it's old-fashioned here. In Korea, to survive, we should change it fast. Cutting cork. To create a cork, they cut the thread shaft partially, but the cork is tiny and which can be easily broken. And the weak point can be cut during the procedure or after the procedure. But that's called a sculpted cork, or it can be also called molding cork. The size of a molding cork is much bigger than that of cutting cork. It starts from USP 10, but it starts from USP number 3 to create USB number 1 size the molding cork. We start from number 3, thicker thread. We cut off the unusualist part to create this size of molding cork. So the decay of cutting cork with the same material is much faster than that of molding cork. So unfortunately, I do not use cutting cork anymore. We've already prepared all the lineups of PLA-CL materials. Molding cork, punch-out cork. They also have that kind of model there. And we also have a meshy cork type as well. Okay, so do not, yes.
I have to interrupt you, excuse me, but for the PDO cork, actually our purpose is not to use only
the physical, definitely I understand that.
There's another purpose.
Yes, I definitely understand that. Because the presentation is strong. Let's discuss after the presentation, could you?
Okay.
Yes, thank you. Actually, of course I understand that. They are also preparing that kind of material as well. Not the thread. It can be an injection instead, someday, in the Turkish market as well. The PLA-CL white, PDO blue. It goes for 6 months with PDO, 18 months with PLA-CL. So let's talk about the products. Monothread, you like to insert a lot of monothread, it's a good way. But if I try to make some visible difference with monothread, I should insert at least 200 threads on patient face. For Koreans, Europeans has smaller face, I know. But then the patient will be a hot job. Yeah. So they get the procedure because of the short recovery time. If they have 200 needles on their face, it takes really long time to be recovered. So I do not use monothread nowadays anymore. The first model is a cog master gear. Molding, bidirectional molding cog thread is loaded on a blunt cannula. This one. Bidirectional means on this part, the cog direction is like this. On that part, cog direction is like that. It's loaded on a L-type cannula. Of course, there are more cogs like that. It's a schematic picture. This is a cog master gear 1. So we should know the bidirectional cog thread here. We should know the mechanism of bidirectional cog thread here. First of all, I will go there. We can put the thread into our tissue here. Then we can pull the both sides of the thread. Extend. Then thread will slide easily because cog direction is like this. There's no resistance if you pull the thread in this way. But then if you release them, it will go back because of the tensile strength. But for this time, this cog will bite or anchor the surrounding tissue and go back together. Finally, the middle portion of the tissue will be contracted and protruded. This is the mechanism of bidirectional cog thread. Furthermore, we can also apply this model for cannula loaded type. I insert the cannula here, and when the cannula end reaches the targeted point, you can fix. 저한테 좀 갖다 주시겠어요? You can fix the thread by twisting the cannula hub 1 or 2 times. Then remove the cannula. Only thread will remain into the tissue. But this part of the thread will be exposed outside of the skin. You can pull the thread a little bit here. This part will go back, anchoring the tissue. But that part will slide easily. Then if you release them, it will go back. Finally, it also happens like the previous model. Mid portion of tissue will be contracted and protruded. I applied the cannula loaded thread on pork belly. The mid portion became contracted and protruded. If I apply this vertically, it means shortening and lifting. This is the main mechanism of bidirectional cog thread. Well, because it's loaded on a blunt cannula, first of all, you should make a puncture with 18-gauge needle. Then you can insert the thread through subcutaneous layer because it's safe. You can fix the thread and remove the cannula. So the same, fix the thread with twisting the cannula hub, pulling the thread, and pressing the skin with the scissors. I cut off the exposed part. Very simple. Yes, this is the bidirectional cog thread. But there is one more type. It's bidirectional type, but that's different. The direction of cog is mixed. This, that, this, that, this, that, this, that. So, with the bidirectional type, you can insert the thread, insert the cannula, remove the cannula, pulling the thread. It's possible. With fixed type, you insert the cannula, remove the cannula, that's all. You cannot pull the thread anymore. It's already fixed there. If you pull the thread, some part of the cog will resist. If you push the thread, even the other part of the cog will resist. So, before removing the cannula with the zigzag type thread, first of all, you should put the patient on supine position. With the supine position, the drooping will be neutralized first. Then you can, with your left hand, you can pull up the patient's face a little bit more. Then apply the thread and remove the cannula. The fixed time thread will fix that status. after removing the cannula. That's all. It's different. Cog master gear 1 and 4 is bidirectional cog type. Cog master gear dual is zigzag type. So because the doctors from Turkey, most of you are advanced doctor, I know. So we should be very sophisticated to deal with this kind of model. So we should master what kinds of cannula are used for each models. This is L-type cannula. Blunt. Previously we used sharp needle, but it's 18 gauge, really thick like a sword. You can, anyway, you can cut vessels, nerves, sometimes parotid gland. It's a disaster. So, to prevent this kind of collateral damage, they built this kind of blunt cannula. First one is L-type cannula. It's L-type. The conventional cannula make some resistance with the cog here, so they cut off that part. So it's L-type. But the effects of L-type cannula is still very sharp. They invent W-type cannula. Different from other pillar cannula, this is packed here to reduce the resistance with the cog here. But it has a lot of resistance when you insert the cannula into the tissue. So more advanced type, W cannula, WA type cannula. So Kogomatsu Gear 4 is loaded on WA type cannula, which reduces the collateral damage and it's easily can be inserted into the tissue. Kogomatsu Gear Duo, do you remember Duo? The zigzag type is also loaded on WA type cannula. Dual. Actually, we have very long bidirectional molding cogged thread, and both ends of the thread, 10 centimeters long blunt needle is connected. The mechanism is also the same. You should make a puncture with the 18 gauge needle first. Then you insert 2 needles of dual thread into the same skin hole. If there is a slight difference between 2 points, the loop of thread will bite the dummies between them. So it will make very terrible dimpling. Don't forget, when you use dual needle type thread, you should securely insert the 2 needles into exact the same skin hole. You may understand, right? Yes, okay. So the mechanism is also the same with the protein type thread as well. This needle will come out here, that needle will come out there. You can pull the thread a little bit more. This part will be contracted. Then you can cut off the exposed part. So I've already talked about the protein type thread, which is loaded on a blunt cannula. The anchoring can happen by the cob itself. So the anchoring is not so stable or secure. But with fixed type, the tissue around here can keep a very stable anchoring. So the anchoring capacity is much bigger than that of protein type. Okay, application. Wow, so it's a boring topic, anatomy. Yes, I've already performed more than 50 times of cadaver dissection to educate the throttle lifting previously. Actually, there are 5 layers on our face. Of course, you know, the skin, which includes epidermis and dermis, subcutaneous layer, then SMAS, superficial musculo-aponeurotic system. Then under the SMAS, it's also called the space or the fat, or some people call it retaining ligaments layer as well. And under that layer, level 5 is the fascia of the muscle or periosteum. This 5 layer, we should know that. What is interesting is that If you are a beginner, of course you are not beginner, I know, you should stay on subcutaneous layer because there are critical structures on the smooth layer. Facial nerve, big vessels, thyroid gland, and duct. If you obliterate them, it can cause a very serious problem. So for the beginners, the optimal layer must be subcutaneous layer. But most of you are the advanced doctor. Sometimes you should go under the smooth layer as well for better correction. I will talk it later. But two most important critical structure. The first one, superficial temporal vessel, because we can insert a lot of thread around here. It's easier to hide the scar of inserting point there, but it's the territory of the superficial temporal vessels, temporal artery, temporal vein. Sometimes you can burst them. It causes a lot of bleeding. Don't be panic. If you press that area for a moment, 1 or 2 minutes, it's really stopped easily. Even though they are on pills of anti-platelet drug, it's okay. Just to press that area sufficiently. Don't be panic. Just the blood, that's all. Bruising, yes, there can be some bruising, it's okay. But the case of parotid gland is totally different. If you injure them, if you injure it, it can create terrible swelling, inflammation, pain. It goes for months. So first of all, we should know the territory of parotid gland, and we should know the depthness of parotid gland as well. Of course, I'm using ultrasound to diagnose before applying the thread. But it's not easy to apply ultrasound to every patient. The location of the parotid gland is relatively quite shallow. Don't forget, when you insert the thread around here, you should be very careful not to insert it deeply. Yes? When you injure this structure, it's a really important problem. I usually apply some medication, corticosteroid, and preventive antibiotics, and NSAID to reduce the inflammation and pain. And I can also inject botulinum toxin around the parotid gland to reduce the production of saliva. The saliva will aggravate the symptom. I've already wrote an article with the salivary, the parotid gland injury during the thread lifting. If your time permits, you can look for. And one more important structure, the retaining ligament. Yes, there is some retaining ligament, but zygomaticocutaneous ligament is most important. I usually apply the thread down to upward, but it can meet this ligament here. If you are not accustomed to using this, you can make a terrible dimpling penetrating this layer. So when you meet this ligament, it's better for you to approach slightly deeper than go superficially back. Anyway, I'll show you later. And one more, I will explain it later. Anesthesia. Because the thread lifting should be applied again and again and again. So we don't have to say hello to our patient. So we should invite them again and again. That's why the pain control is most important. Yeah, ointment, the lidocaine injection. Sometimes you can apply tumescent solution. In my case, I should apply at least 40 threads for one patient. Yeah, I apply IV sedation with the propofol as well. But it's not usual. But usually, the most reasonable tools for the pain control must be tumescent solution. If I inject lidocaine solution, it's too strong. It can also cause seizure. So it's a diluted type of lidocaine solution. 10 cc saline with 100 cc saline, 10 cc bicarbonate, 20 cc lidocaine, 1 cc epinephrine. You should know the bicarbonate, which reduces the acidity. So when you infiltrate this tumescent solution, if it's less acidic, it will be less painful. That's why I use bicarbonate. I infiltrate the tumescent solution with a long, thin cannula, 23 gauge. Not the needle, not the needle. So to show the difference before and after the procedure, we should have some target of correction. The lateral eyebrow hooding, theater or nasojugal groove, nasolabial fold, midline line, and jowl, and medial neck pudging will be the purpose of thread lifting. I'm so sorry. 이거 좀 나눠주시죠. 이거 좀 나눠주세요. I'm so sorry. I've already prepared handout, but we forgot it. 저쪽에 있는 걸로 좀 나눠주세요. Because of the patent problem, I cannot give you this file. Instead, I will give you the hard copy. Yes. You can keep the handout and please return the plate. Okay. 펜 하나 주세요. 펜. 예. 죄송합니다. These anatomical chains can be created by the anatomical structure as well. Most of them are related with retaining ligament and the superficial and deep fat compartment. Okay, let's talk about the lifting. What's lifting? Before the lifting, we should know the drooping. For the drooping, there are two parts. The first, movable part. Second, the fixed part. For example, from here to here, there's a fixation here. The movable part will flow down. They will extend here and contracted, collected here. The tissue will be protruding on lower part. So lift means on upper part, we should pull up the tissue. On middle part, we should fix the tissue there. On middle part, we should extend the tissue. That's lifting. So just the pulling up is not lifting. Pulling up should be applied on upper part, and extension should be applied for lower part. When the tissue is collected, again, so this is the application. Oh, of course you have that cut is there. You don't have to take a picture. It's a label there in your handout. I can make a 2 inserting point just below the eyebrow to hide the scar on the lateral cornea or lateral limbus line or lateral canthus line. I usually use Kogomaster gear 4 thread, but because there's a curvature, it takes a technique. You should insert the straight cannula along the curved surface of the forehead to the hairline. So it's very easy because there's a curvature, but you can apply it. I prepare the layer of under smooth layer. Frontalis muscle is smooth layer here because this thread is quite thick. The contour of the thread can be observed on the surface. That's why I prefer to insert the thread on deeper layer. And I will apply reinsertion technique. Because I cut off the thread, the anchoring is not sufficient. I inserted the cannula here and remove the cannula, then reinsert the cannula to the lateral side to use the thread completely, and which also can give us a very stable anchoring here. I usually apply the 2 threads on each side. But for Koreans, different from European, we have naturally laterally stented eyelid. I should correct the middle side as well. But in Europe, you can also, this is also called the Paxi eye procedure, right? Yes. You can correct right side only. And It's not released in Turkish market. It doesn't have approval there. I also use this kind of model, Paxi Flex. The thread is loaded on a flexiform cannula. It's not released there. I hope it will be released there soon. Instead, I can also use a dual needle type thread as well. It's also the same. One inserting point, I can insert one leg of the thread and advance it and come out on hairline, near the hairline. I can also insert one more needle. But for this time, I do not advance them to the lateral side because the length here are very narrow, very short. I cannot make enough anchoring. Instead, I can insert the needle into the contralateral side to have more distance for better anchoring. So I applied cobalt type thread here, the cannula type, two cannula type thread here, applied one dual needle type thread there. This way, and dual needle this way. So Korean skin is heavier, and it's really difficult to correct like this with a thread. To correct nasal jugal groove and nasal labial fold, the next picture was better. I make pole inserting point, 2 on the level of eye, 2 on the level of eyebrow. It's 1 centimeter away from the hairline. I don't want to insert the hairs into the inserting point. I usually apply the dual needle type Kogumaster Gear 4 thread, the straight one. You can advance the thread to the 1 centimeter lateral of nasal labial port. If you advance more, if the thread anchored the deepest part of nasal labial port, then you can pull up the nasal labial port will be aggravated. So you should stay at least 1 centimeter lateral of nasal labial port. It's a very important point. And reinsertion, I can advance the thread to the temporal side. Here, go back, here again. 2 for the nasolabial port correction, 2 for the nasal jugal groove correction. Actually, I tried to counterflex with the thread. But for this time, the thread and the should stay upper part of the nasal jugal groove. If you advance more, it will also aggravate nasal jugal groove as well. You can apply the dual needle thread instead, but it will create some outcoming point. It can be visible scar, but it will be disappear, but the patient will complain for several weeks. But anchoring is better. And one more thing, nose thread. We've already talked about the contracting thread, pulling thread, right? Bidirectional pulling thread and fixation type thread. This is extension thread. The direction of the curve is totally different. We use this thread for extension, not contracting. So I elongate nasal dosum and apply the thread. The thread will remain the extended distance. It's also happened for the columella as well. It's extension thread. I'd like to lift the tissue on anterior molar. So I can make a line on the lateral limbus level. This is a nasal tear tube. So you can make an inserting point slightly upper than the tear tube. You can insert Bisu 2. The thread for columellar elongation. If you pull 4 of them here, if you insert 4 of them here, you can pull the anterior malar tissue slightly upward. It can correct the lateral part of the tear tube properly. But on medial side, you can also inject multi-line thread, or you can also inject filler as well. To correct the nasolabial port, it's fixation is a nasolabial port. The port can be created by the drooping of skin. They collect a lot of amount of skin here, so we should extend that tissue there to improve nasolabial port instead of pulling but extension. So I use BIJU2, the thread used for the elongation of nasal dosum. I insert 2 needles with this method, but you should be very careful. The thread sometimes can stick out. So we are redesigning this thread nowadays. You can meet the new model soon. So there's a stepping, there's a stepping on nasolabial port. These 2 threads will lightening the stepping, make it less dominant. I apply the thread to correct the middle face with this patient and this patient. And furthermore, I will apply the thread on raw face. The layers of temporal area is really complicated. Skin, subacute, superficial temporal fascia, and loose connective tissue, then superficial layer of deep temporal fascia, pad, deep temporal fascia, and muscle. Then there's no periosteum, bone. Very complicated, but we can just memorize. We can insert the thread just under the superficial temporal fascia. Well, if you apply the thread down to up method, if you insert the thread here, you can meet some resistance. It's a zygomatic cutaneous ligament. After penetrating it, you can meet some movable anatomical structure. On that point, you can go under the superficial temporal fascia. You can feel less resistance because there is a loose connective tissue there. Anyway, to correct the nasolabial port is really difficult because that's the final conclusion of a whole drooping on our face. I apply a lot of thread to correct it. Korean has very thick skin and very heavy skin. I insert at least 4 threads from the jawline and advance it to the temporal area. As I mentioned, you can feel some resistance around the zygomatic cutaneous ligament. After penetrating it, the thread will naturally go under the superficial temporalis fascia. I've already reviewed this application with ultrasound. Sometimes you can go deeper, sometimes you can go superficially, but usually you can go under the superficial temporal fascia. But for this application, I prefer to apply Koch-Master Gear Duo, the fixation type thread. If I apply bidirectional type here, it will create a irregularity, which can the patient will complain of that irregularity. To reduce the irregularity, I prefer to use blue Koch-Master Gear Duo. And furthermore, I will apply 12 Koch-Master Gear 4, the bidirectional thread, from the side bone or anterior point of tragus, advance it over the marionette line. So it's very interesting. Usually, in my opinion, the thread end should be located before the marionette line. But for this case, because I apply the reinsertion technique, then the thread will pull back. But I'd like to put the thread just before the marionette line. That's why you should put the cannula end over the marionette line. So I will show you this application in my operation room precisely. I will also apply the application technique as well. It can be applied with dual needle thread as well. It's very simple. But don't forget, the upcoming point is lower than marionette line. Furthermore, on middle side, the direction or the vector of the drooping is different on lateral side and medial side. On the lateral, upper lateral to lower medial. On medial side, upper medial to lower lateral. So I applied this kind of thread here. Of course, I'm using Kogomaster gear duo instead of bidirectional thread. If I use bidirectional thread, the tissue will be contracted around here, which can aggravate nasolabial fold. That's why I prefer to use a fixation type thread. Furthermore, there's a stepping across the marionette line. I apply BU1 thread, like the nasolabial fold, to flattening the stepping here.
This one is the dorsal or
도전, long one.
Okay.
Yeah, the child became much better. Actually, she's my Japanese patient. Have you ever heard of Mashimaro? Do you know that character Mashimaro? Do you know? Marshmallow? Not marshmallow, no. The character, the rabbit character. You know? It's not popular there. Maybe anyway, her nickname was Marshmallow. So I applied a lot of thread to correct her drooping, the severe drooping around here. So to correct the medial neck hooding, it's very conventional. You can make a 2 inserting point and apply 2 thread. But furthermore, I prefer to apply this technique additionally. But I applied the thread from the anterior side of the tragus and advance it to the 1 point just under the jawline, and I will reinsert the needle into the skin. But there will be a dimpling here. The dimpling is very terrible. I will show you later how can I reduce the dimpling. There's a very specific or very unique method to reduce the dimpling. Yeah. I will show you later. Yeah, the drooping improved a lot. Nose thread, as I mentioned, it's not shortening thread, it's extending, lengthening thread. 2 types, BG1 and BG2. BG1 for dorsum, BG2 for glomerular. So actually for Caucasian, European, Arabic, there are a lot of patients who have drooped laser tip. So a lot of them don't want to elongate their laser dorsum. But if I insert the BG2 thread to correct, to lift up the laser tip, it will be very useful. Like for this patient. But for Koreans, we'd like to augment our nose. We'd like to lift up our nose as well, but sometimes we'd like to elongate the nasal dorsum as well. But if there is a hump here, there's a depression over the hump. Usually we can inject filler instead, but as we know, sometimes filler can cause terrible complications like embolism, blindness, necrosis, and the filler will spread, and which can make some blunt contour. Koreans don't like that blunt contour. Instead, we can feel the thread. The multi-thread, I've informed that 14 thread is loaded on one L-type cannula. So if you insert one multi-line thread, you can insert 14 thread at the same time. I usually insert 4 to 8 multi-line thread, which can make some volume and some line around here. It can correct the depressed contour over hump. I didn't use filler to correct her. Okay. This is the end of my presentation. Do not forget this one. This is a take-home message, PLACL. So you cannot use PDO anymore in your clinic, promise? Then you should memorize the model name to order easily. Mr. Ed is watching us. This one, the bidirectional molding cork thread is loaded on L-type cannula. It's called Master Gear 1. WA cannula, coke master here 4. Furthermore, zigzag type molding coke is loaded on a WA cannula. It's coke master here 2. Not forget this. The N dual needle thread, multi-line thread. Okay, this is the end of my presentation. Thank you for your patience. Yes, please.
Again, me. First, I want to ask that if we use nasolabial port or marionette, if we use coke, we must put the coke to lateral default. It's true? Lateral. Not here. Coke. If you use
no.
lateral.
Ah.
Not here.
Oh.
We can the lateral of the port.
I understand it.
But if we use the dorsal, we can put the video the middle of the fold. Is it true? Just this. If we use coke,
You can just tell me.
Coke.
You can
If we
explain here.
if we use coke, we can put here the lateral of the fold. Is it okay? If we use the dorsal nose,
No, different. Sorry. Okay. I will explain this again.
Pardon. Sorry bir daha Türkçe
şimdi
I understand it. I understand the
Böyle
question
Şimdi
because
eğer bir kok kullanıyorsak nazolabial portun marionetin dışından girmeliyiz. İçine asla. Öyle
I
değil.
understood.
Ama eğer dorsal nose şeyi kullanıyorsak, dorsali de kullanmayı öğretti ya, onda medialde
Here.
kullanmalıyız.
Right? So don't forget, the inserting point
Yes.
is medial of nasolabial port
Yes.
because
Medial, yes.
it's not pulling thread. Actually, it's extension thread. The purpose of this application is flattening the nasolabial port, extending the nasolabial port. Do you understand that?
Yes,
So-
I understood true. Okay.
Yes, I apply the thread on the medial side. Medial side.
Okay.
On the nose, we should make some.
I know the nose.
Okay.
I want to ask.
Why not? Why
I
not?
know
Definitely,
the nose.
yes.
The same is the marionette.
Yes,
Coke-
medial side.
Anladın mı?
Medial side.
Kok
Yeah.
kullanıyorsan lateral.
Right. Yeah.
Burun materyali kullanıyorsan medialden.
But don't forget,
Anlatırım.
the thread can be easily stick out.
Okay.
So you should keep the thread end
Yes, I am.
into the tip layer. Okay.
And the second
Uh-huh.
question.
Yes.
Second question. In Monaco, I think 2 years ago, one plastic surgery said that if we want to try to lift it with coke straw,
Yes.
we check the face skin and we check the skin. If the skin more than 3 centimeter here, we check 3 centimeter, more than 3 centimeter. First, we want to use the device treatment and then coke.
It must be his criteria, but it's a good idea, I guess. Even in my clinic, I applied energy device before the procedure, to have more improved result as well. In my case, I applied the HIFU, or I applied some
No, laser,
Yeah.
microneedle frequency.
Mix.
Yes, mix, and then the less than 3 centimeter, we can do coke. But more than 3 centimeter, this part, it is not useful for this skin. He said like this. So I check my patient. I'm a dermatology professor in Ankara. So I check the skin if more than 3 centimeter. Yes, first I do the laser or microneedle, and then 3 months later I do coke.
Okay, it must be his criteria, I think.
Yes.
He's not a god. He cannot say so clearly like that, right?
What is your opinion about
I actually
this? Yes.
both, usually put both. But it depends on not the criteria of the skin drooping. I depends on the patient's taste. Patient's taste. They want to correct more. Yes, you can advise. I can advise. Please.
So how you check the skin? For example, which face you can say I never do coke? for this phase? Do you
Ah,
have some
yes.
research?
Actually, infrared is very rare, but the patient who has very thin skin, the control of the thread can be exposed under certain surface. In that case, I do not apply the thread. And the patient who also inject some unknown foreign material, I do not apply because it can cause secondary infection. You know, some people inject on their face with some unknown materials like a paraffin, silicone. In that case, I do not apply thread as anyway.
Okay.
Mhm.
Okay. Thank you so much.
Yeah, thank you. Thank you.
Can you please after the picture? Can you pass up the picture? Yes. Which one use Visu2?
For the correction of
Which
the
one?
Visu
Kolumella.
Columella.
Ha.
Columella.
Yani burnun kolumella.
Visu 2'nin iki sayısı var da hangisi?
Bu kolumella olan burası.
Right, right. Because it's a short.
Şu olan. 8 var.
Short.
Hı.
Yes.
Bir de 60.
Yeah. Thank you for watching the presentation. We will have a break here, and you can have lunch. After lunch, we will move to upstairs, and you can wear the gowns and gloves like that, and we will go to the operation room. I prepared 3 cases. 1 case for the demonstration with my patient, and the other 2 cases of patient, you can apply the thread if you want under my supervising. Okay? Thank you very much.
Thank you.